We wanted to bring on Lisa Bordallo of Catholic Social Services to talk about a food drive that they're doing. Obviously, the holidays. We heard from the Salvation Army just a couple days ago. They're looking for donations of food or for their pantry, donations of money so they can go get some toys for the holidays. And CSS kind of in that same lane. We're shaking the tree, looking for some help, Lisa. So let's tell the Link fam out here how they can help Catholic Social Services and the island's needy and vulnerable. Good morning, Lisa.
Morning, Chris. Morning, everybody.
Good morning.
So go ahead, let us have it.
Sorry. So, good morning. I know we want to talk about, the COVID situation and the food drives that are going on and, running this food pantry, this food bank here, and how we're outreaching to a lot more residents of Guam and trying to help everybody out there that needs help. So we are working, our most recent venture is working with Payless Supermarkets, and they're doing a really big food drive from November 1st through December 31st at all of their Payless markets to help drive food, canned goods, dry goods, to benefit our food pantry here at Catholic Social Service, which is really turning into a food bank. We've grown so much. And so, that helps to feed those in need, not only with our programs, but the folks that come to our food bank or food pantry seeking food assistance. And then also, we do outreaches as well every Friday to the street homeless, folks out there who are at Gura housing, folks out there who are in substandard housing, whoever we can reach and whoever we can help. We've also been going out and delivering to families who are quarantining because they're COVID, their family tested positive for COVID. They can't go anywhere. So we've also been helping them, get them some food because it's tough. It's tough for everybody. So we're doing our best. Yeah.
So Lisa, if someone in the family tests positive for COVID, how do they get these deliveries from CSS? Do you guys get like the list from public health, or is it on the families to reach out to CSS?
We get it from all sides. Sometimes public health will call us and say, hey, we have, a family here or there that needs food. There's children, and sometimes the families contact us.
Oh.
Something was disconnected.
Oh, there. Okay.
Sorry about that. The auntie's calling. So the families contact us directly and they say, we need some help. We can't go anywhere. And we get, referrals. So we do our best, put some bags together, drop it at the gate, drop it at the door. And public health has definitely been helping families and reaching out to us, letting us know what families are in need,
How many COVID cases has CSS had with its staff?
With its what?
How many CSS staff have tested positive for COVID?
Oh, I don't know. We've got so many programs and we've got so many employees, and I know there have been some relatives and scares, and I don't know. I really don't know if there've been, I know that we've, all been trying to be safe, and we've been constantly testing because, we've been in contact with the public, and, some employees, they get tested, and, some people take leave and stuff. So there hasn't been any major outbreaks or anything, but as far as everybody's personal test results, I can't say.
We just had Mr. Kando on from the Guam Memorial Hospital, and he was talking about the SNF patients that were moved over under the care, I guess, of Catholic Social Services. Can you tell us a little bit more about how many patients we're talking, or where are they at, and who's...
So up here at the main office building, there is we're have our main office building, and if you know where that is, behind Rev Taxis in Barragata Heights. Next door, we have another building which used to be our adult daycare facility for adults with severe disabilities, and then that building has been rented out to Guam Memorial Hospital for their skilled nursing facility because they're trying to keep them safe, and I know that there, people are like, oh my gosh, we see GMH people and we see, there must be COVID patients there. But, just to clear the record, that is not the case. Obviously, we're trying to keep them safe. And, and this area is pretty safe. We try to, there's no traffic. And they're definitely distanced from any possibility of COVID, so they are there. They've been there for months, probably since I think they moved in March. Up to how many patients are in there? I don't know. It doesn't fit a whole lot. It's not like there's it's jam packed. But the skilled nursing facility, I don't know how many patients their capacity is. But it's pretty mellow. It's pretty calm. It's the same employees that that come in and go, and they've it's a 24-hour operation, and that's really all I can say.
You're staffed by GMH?
Yes, staffed by GMH. All they really do is lease the building the building from us. We don't we are not providing any care, and we're not providing any social work to those skilled nursing patients.
What's the layout like? Are we talking like hospital beds with IV setups and all kinds of like monitoring gear? Or
I know the layout, prior to them moving in, and then when they were moving in, we assisted them with, in that I know that it is when you walk in, it is a big open space, but there are little rooms on the side.
right.
So, and there are, I believe that they do have, hospital beds set up for their patients in there. And I believe some of them have, their private rooms. I don't know in the main area whether there are, beds side to side, but I don't think that they have that many patients where it's, they'd have to use, that it's really crammed in there. But yeah, it's pretty spacious. And then there are private rooms, and, there are kitchen, bathroom facilities, of course. So, hopefully they've got all they need.
Now, these are elderly patients?
Skilled nursing patients. Oh, I believe some of them are elderly. I don't know if all of them are elderly, or I believe that they just need, some very direct care. So yeah, I know that some of them are elderly for sure.
How much are they paying Catholic Social Services, and is this the month-to-month lease or?
I don't know. I mean, this is something that's the Diana question, because I'm not privy to the details of the agreement. So, I just know that they did request to lease the space, but they wanted to move the patients, especially in light of the COVID situation and keeping these folks safe.
Okay. Yeah, we can check.
Yeah, sorry, I don't know more about that.
All right.
They're our neighbors, and we pass by and we say hi, but we really don't. We don't go into their operations or see a lot of the patients and interact with them in any way.
Right. Lisa, so if people want to drop donations up there at CSS, maybe even businesses, or what's the protocol? Are you guys under different rules for COVID? Can they just come anytime?
We are, with regard to so overall Catholic service, food assistance and all of that, and everybody else's safety. We're not accepting illegal dumping, but food donations, we also need people, and that is like the biggest operation right now for us, is because there's so many people in need, and our client base is just climbing. So to drop food, they just need to give us a call and let us know that they have a food donation, and we we will accept it, and we try to sanitize as best we can, and we add it to our, our bags and everything. We distribute it to the community. Financial or monetary donations are, of course, always accepted. We have our website and people can go on and pay with their credit cards or whatever, just to help out a little bit. Every bit helps. And we've been very lucky that the island residents and a lot of the, corporations and the community as a whole, the Guahan Sustainable, the farmers, everybody has come together to, to try to donate and give food so that we really help during this COVID season.
Well, thank you so much, Lisa.
So our number is 635. Thank you. I really appreciate you bringing me on to let everybody know about this Payless Food Drive and how they can help.
Lisa, can we get the number one more time? Because you kind of slowed way down.
Okay, yeah. Our phone number is 635-1442. You can give us a call and we can give you further direction on, whatever it is you need, whether you need food or we want to help with food drive or help in any way. We can give you all the information there. You can also find information at our website, catholicsocialserviceguam.org. And you can find all the information that you need there.
There you go, 635-1442. Call them up, give them money. Thank you, Lisa.
Thank you.
Okay. Right.
Thank you, Chris. Thank you,
See you guys.
Sabrina. Take care, you guys.
Okay.
You too.
Thanks,
Right on.
Jason.
10:01, Bree.